it juicy. Now that's a way to have a good, flavorful hamburger. If we were really good, that's what we'd be doing instead of just getting home in time to throw something on the grill. And yeah, how do you treat anxiety? We talk a lot about anxiety, don't we? Those of you who have been here before, you guys know that we talk about wanting to avoid medicines called benzodiazepines. That would be your Valium, your Klonopin, Ativan, Xanax, all those things that cause dependence, meaning you get to a place where you need it, and tolerance being where you take the same dose and it doesn't give you the same effect as it used to because your body's used to it and it just needs more and more and more Xanax or Valium or Klonopin, whatever it is you're using. We know that people who use those medicines, compared to people who would get a placebo in a study, will have the panic attacks last longer when you don't have the medicine around than the people who don't use those medicines. So it's actually making the problem worse, even though it helps in the short term. And here's the real frustrating thing. When people have a problem with anxiety and have used Klonopin or Xanax, and they really like that it takes anxiety away, of course you do. It's an awful feeling. People would do anything to get rid of it. The problem is they are incapable, to a certain extent, of reasoning to think through, this is not a good thing for me to keep doing. It's going to be worse down the road. It's like people who take out short-term loans thinking that it's fixing their problem today, but then they have to pay off all the same monthly expenses the next month plus the interest from this loan, but yet they keep doing it and get deeper and deeper in debt. That's happening at the anxiety level of life when people use benzodiazepines to treat their anxiety symptoms. There are medicines that can help. Of course, I think any kind of counseling that can get rid of it would be better than taking a medicine for it. But if you were to use a medicine, you want it to be something like an SSRI or something in the Prozac class, or something like Buspirone, or Buspar is the brand name of it. These are medicines that can help you to not have the underlying anxiety, so you need the pill. And then over time, hopefully you can wean off of those. Generally, I, with my patients, will try to wean them off at 6-month intervals. Have a visit and say, okay, let's try it, let's see if we can do it. Sometimes you can, sometimes you can't. Sometimes the patient will say, no, I'm not ready. But I'd much rather have them continue the Prozac or related medicine than be so dependent on a medicine that acts on the GABA receptors like the benzodiazepines, which, by the way, that's the exact same receptor that alcohol works on. It's the same thing going on in the body as when you drink alcohol as far as how it relieves anxiety. That's why they can be substituted for each other in withdrawal. In fact, alcohol withdrawal is treated with benzodiazepines. Caffeine withdrawal, does it really exist? Oh, it absolutely exists. Caffeine withdrawal headache is one of the most common things, and then a little bit of sluggishness that you can have as you get over the caffeine withdrawal. Caffeine withdrawal is one of the 3 C's of Dutch Brothers. Dutch Brothers, which I do like, but there are the 3 C's. The 3 C's are the caffeine withdrawal, the cost, and the calories. Okay, how about medical terminology, Pictionary or something like that? Interactive. I have caffeine withdrawals. Interactive, this is interactive here. I'm talking to people about their comments and questions. And for something a little different from this, I'm hoping to do the comedy, the Dr. Ribble, which again, you guys don't have to watch if you don't like comedy. You can stick with this channel if you like real. So I'm going to get back to my family because we have important questions to cover here too. Empire City Ray agreed. Yes, Empire City Ray, we appreciate you watching. We appreciate whoever agrees with you. Boss File 92. Okay, I'm going to get off and then I'm going to follow everybody new who followed. Thank you. And thank you for sharing with friends. And thank you for subscribing to our YouTube channel, which is Auburn Medical Group. Until next time, this is Dr. Yes, thank you. Thank you, everybody. You guys too. This is Dr. Mark Vaughan telling you to stay in good health.